Not because the humerus could be lateral, but the actual structures of the clavicle and everything else is still pretty much AP. So by us moving the patient away from the IR will give us some oblique projection with a lateral view of the scapula. Does it make sense? So second years last year, there was a Y view, and on the test, they asked, what projection is this? And a lot of students answered it, lateral shoulder. It's not really a lateral shoulder. It's an AP oblique of the lateral, AP oblique of the scapula for shoulder. It's not really a lateral shoulder because lateral shoulder will be truly like this, but then you don't have a lateral shoulder. Okay, so the next thing I'm gonna do is create my nicely Y view. I'm gonna show you the Y view first, and then I'm gonna show you the gray sheet, okay? So most of the hospitals will ask you to do a Y view instead of the gray sheet. So the first thing I'm gonna do, I'm gonna just turn you away from me. Go ahead and scoot over a little bit. And what I'm looking at here, there's 2 points. See the acromion? So the way I'm gonna find it, I'm gonna put my hands very gently in here, and I'm gonna put my index finger right in the middle, kind of like dissecting the whole entire deltoid muscle. Then I'm gonna rotate her so until my finger is aligned with C-rack over here. What am I feeling for? Scapula. Which border in particular? Medial. Ma'am, can you put your hand around your abdomen for me? There you go. Now, see what I'm gonna do with this finger? I'm gonna flip it like this, and I'm gonna go right against her back. And while I have this here, I'm going to match this. See these fingers here? I'm gonna match with my rotation. If she's under, this finger is gonna be back here. If it's over, now my medial border is gonna be posterior. You see that? So I'm gonna match them to where they superimpose. Oh, lovely, right there. You see this? One in there, one the other. And I'm just gonna recenter. So the center right enters right at the surgical neck. And this should be giving me a nice superimposition of both margins, both borders. Now, in terms of length of my IR, you have to switch. Now you have to do start off with the 10. The 12 will be the longest now. Okay? Because now you wanna catch all the way down to the scapula back here. And then you're gonna need less back in this area. Not so much 12 this way, but the 12 will be now lengthwise. Does it make sense? All right. So notice how the light is projected here. That will be your 12 inches back here. It looks smaller here, but in reality, this is how much more you're getting back here. Can you see? Okay, all right. Remember, the closer the anatomy part is to your tube, the smaller your field light is gonna go. That's why I keep telling you, do not use top of the light here and top of the light there. Because the bigger your patient, the smaller that light is gonna look, and you're gonna end up doing a 14/17 Y view. Okay? So stay at your 12 margin, lengthwise, that's all you need with proper centering at the neck. Any questions for the Y view? Very simple, find it and then match it, okay? And there is many ways of getting this projection or this view done at the hospital. Depends who you talk to, they're gonna be like, oh no, this is what's easier for me. There is some where they go here and they find it here. There's some where they find the scapula and they match the borders back here. There is different ways. I'm gonna show you this today because I want you to learn it one way today until you master what you're looking for. Then if later you find that it's easier for you to do whatever, then you can change, okay? But I only want you to learn one way today. I don't wanna confuse you too much. Does that make sense? I don't wanna throw you this and this and that. Just learn it today, and then if for Sims you wanna do something else because you practice in clinic and it worked for you, whatever, I will take it. But remember, I pretty much know all of them. And if I go in there, if I feel it's not what you're showing me, then you might lose. Okay? All right, so that is your YView AP. Yes, sir.